Okay, hello again. Welcome to the webinar about social dialogue on transition and sustainability with civil society organizations in the HIV, TB, and malaria response in Guyana. It's a pleasure for me to present from the LAC Platform this webinar. My name is Diego Mora, and I will be facilitating the session today. Today, we are accompanied by Ms. Marta Carrillo. She is the lead consultant at MC Consultancy, Sexual Health and Development. Presently, she serves as the Caribbean liaison for the LAC Regional Platform. Ms. Carrillo has a wealth of experience having been involved in the HIV response nationally and regionally for over 20 years. She has served in several capacities, including director of the National AIDS Coalition of Belize, country representative for USAID projects in Belize, including PASMO and PASCA. As a consultant, she provides technical support to key regional entities such as PANCAP, CARICOM, the Global Fund, the Caribbean Vulnerable Community, CORIFLAX, among many others. Most recently, they have served as the Latin American and Caribbean delegate of the NGO delegation to the UNAIDS PCB. Ms. Carrillo holds bachelor's degree in psychology from the University of Louisville and master's degree in counseling psychology from the University of West Indies. For us, it's a pleasure you can join in the webinar today for the importance of the social dialogue in Guyana. Without more, I want to say hello and give the microphone to Ms. Carrillo.
Okay, good morning, and thank you very much, Diego. I just want to make sure that you can hear me and you can see me.
Yes, perfect. I can hear you perfect.
Excellent. And I also want to thank the persons that have taken the time to join us this morning for a presentation that we have been very excitedly waiting to make as we share our experience in Guyana during the process of civil society dialogues, in particular looking at transition and sustainability of the response to HIV, tuberculosis, and malaria in Guyana, beyond the Global Fund and beyond other external donors and support. I want to take this opportunity to thank the key stakeholders in Guyana that worked with us last year to facilitate the process of consultations as well as the one-day social dialogue, which really provided us with an opportunity to document an important process for civil society, but also to take the right step in preparation for transition and sustainability of the response of the three diseases in Guyana. I want to, in particular, thank the Guyana, the Guy Trans United GTU that provided all the logistical and administrative support for this process. I would like to start off by sharing with you that when we decided to come to Guyana to replicate a process that had started already in some countries in both Central, South, and the Caribbean region, we did it fully cognizant that the process that had been piloted in these countries had truly shown the effectiveness of a methodology that was civil society led. We know that many times when we speak about transition and sustainability, about the response to the different diseases, it is sometimes a top-down approach where civil society would be the ones that are invited to participate in a process that is a lot larger. But in this particular case, we were very excited to see an exercise in which civil society took the lead. And for this reason, I commend civil society organizations in Guyana that participated, as well as in the other countries where the methodology was piloted. So basically, the process was one in which we engaged civil society organizations in discussions related to transition and sustainability to be able to identify specific risks for the sector as well as opportunities. So the process provided not only for consultation and discussion, but also for the development of a plan of action. So if you will allow me, I will share with you just very briefly in terms of the context of Guyana. And I know that some of this data might probably be, if there's now a 2017 report, a little bit outdated in terms of 1 year. But since the process took place last year, let me share that in 2016, the HIV epidemiological report, the Ministry of Health in Guyana was reporting a adult prevalence rate of 1.6% for persons between the ages of 24 to 49 years old. And in 2014, there were 17,599 reported malaria cases, with a reduction to 17,000, with a reduction in 2015, while TB prevalence in 2014 was reported at 103 over 100,000 population. To date, the fund has invested US $44,674,960 in the Guyana response to the three diseases. And this has resulted in 4,800 persons living with HIV on ART treatment, 2,210 new smear positive TB cases detected, and 127,000 malaria insecticide treated nets distributed. Now, when we speak about the investment that the Global Fund has made in Guyana, it is important to stress that the support from the Global Fund has been based on the need within the country, but also the proven efforts of the stakeholders in Guyana to show that the investment was making an impact. Now, presently, as countries in the region, both Latin America and Caribbean, are confronted with the reality of decreased grants from the Global Fund, as well as other entities such as the US government's PEPFAR, it is important that we can recognize the investment that has been made, the impact that it has had, but also what are the different challenges and opportunities confronting the country, in particular civil society, so that it will be able to transition without any major disruptions to the achievements and the needs within the country. Now, what was the process of the social dialogue? Well, the process was conducted in Guyana, Georgetown, Guyana, specifically in May of 2017. And the report presented to the LAC Regional Platform in June. In accordance with the methodology, it included a desk review of key relevant national documents on the situation and response to HIV, TB, and malaria, in particular as they relate to civil society. And then as a consultant leading the process, I had an opportunity to travel to Georgetown, Guyana, and work with the Guyana Trans United to conduct one-on-one interviews with representatives of 13 NGOs in Guyana. These NGOs being NGOs working in the field of HIV, TB, or malaria, who have or may have not had some contact with the Global Fund processes. So with the support of GTU, the Guyana Trans United, a one-day working session was held with representatives of 10 civil society organizations to consolidate the findings and build consensus. I must share that the process was a very successful one in which we did not only have the participation of civil society organizations, but also of representatives from the Country Coordinating Mechanism Secretariat, who were involved in the process from the planning stages up until the end, as well as representatives from USAID and UNAIDS. An integral part of this process was the engagement of the CCM from the onset, which we believe is very important as we expect that the continued support to civil society will be there as members of the CCM. As a result of the dialogue, civil society organizations were able to forge a joint vision and discuss risks and mitigating actions from which a plan of action was developed. And the findings of the process and the plan of action were shared with stakeholders at the CCM level. It was also agreed that a webinar, which is this present webinar taking place today, would be planned to share with other interested persons and agencies in Guyana and the region. It is my hope that even if today, for this webinar, we do not have as many persons from Guyana as well as the region as we had anticipated, that there will be opportunities for this recording to be shared so that other partners in the region will learn from the Guyana experience and see the value in replicating this process for civil society within their different countries. So this process and the report will now serve as an important guide as the country implements its transition readiness and sustainability planning. And this exercise has placed civil society in Guyana in a crucial and significant role in this process. Next. So upon the assessment of the findings from this review of the situation and the response, discussions with the different civil society organizations, as well as the social dialogue, there were three areas identified as priority areas. And I must highlight that when we identify these as priority areas, it's specifically because these are the areas that we feel need to be strengthened, need to be focused on as the country prepares for transition to ensure that achievements and the work that has already started in Guyana will be sustained beyond its present funders. And so there were three key areas identified by civil society organizations. The first being the need for sustainable programming for key populations, sustained governance and partnerships, and financial sustainability of civil society response in Guyana. Now let's look at sustainable programming for key populations. The process showed that specific risks to sustainability under this particular priority area were, and not limited to, but these are the four main areas of risk that were identified. Legal barriers to access to services for key populations and no legal protection for victims of discrimination. We know that within our different countries in the Caribbean, key populations are now the key focus of many of the response, but we also recognize that there are many still existing legal barriers and lack of legal protection for these populations for them to adequately be able to access much needed services. There is also identified limited capacity of some civil society organizations to sustain their programs. For me, I found this to be a very interesting situation from which I could speak personally, because I remember exactly about 9 years ago, 8 years ago, visiting Guyana at a time in which I also consulted with different civil society organizations. And I must admit, coming back to Guyana 9, 10 years after and realizing that many of these organizations no longer exist or their capacity has been decreased drastically. And really to see some of these civil society organizations struggling to continue to provide their services is a clear indication that the funding support that many of these organizations have been receiving has decreased to become non-existent, affecting their capacity to sustain their programs. So this is definitely an area for concern, as it is expected that more civil society organizations will be impacted by the transitioning of these big funders from Guyana. Also, inadequate data on key populations for evidence-based planning. We recognize that this is a situation that needs urgent attention. For there to be planning that will be effective, these must be based on data. And unfortunately, as it relates to key populations such as men who have sex with men, sex workers, the transgender persons, this data is inadequate, does not exist, or very limited. In terms of governance and partnerships, the need for a sustainable governance and partnership. Risks to sustainability include that TB and malaria are not specifically included as key components of the overall National AIDS Strategic Plan. Now, let me explain this. There are programs or there are strategic plans for TB and malaria, but under the Global Fund project, there has been a joint program including all three diseases that might be affected beyond the Global Fund transition. As well, the country coordinating mechanism is a global fund mechanism that is dependent on the Global Fund, a multi-sectoral mechanism that has been effective. How does this affect the response to the diseases beyond the Global Fund? The lack of meaningful representation and participation of civil society at the National AIDS Program and CCM level was seen as an area of concern for many civil society organizations, and the limited coordination and communication among civil society organizations for collective action is also recognized as a risk to sustainability. So what were some of the, when we look at financial sustainability, what were some of the risks to sustainability? Again, very important, the lack of financing to sustain their organizations and programs, especially for key populations, and limited capacity to mobilize resources at the international and national level. We must highlight that we know that beyond the transition era of the response to these diseases, it is highly likely that to some extent the governments will be able to provide the needed finance, at least to cover some of the gaps. But there are concerns in regards to key populations, especially those that are still criminalized within our different countries. Where will the support come for the work with these populations who in most instances are the most marginalized and the most affected by HIV and the other diseases? Also, the limited capacity of civil society organizations to mobilize resources at international and national level. Many times, civil society organizations are seen as having not met the specific criteria to be able to access international and national resources. And so it's very important that there be investments in building the capacity of these civil society organizations so that they can mobilize their resources. And thirdly, lack of an investment case, which highlights the value of the work of civil society organizations. So I just wanted to share with you, if you could look at this slide, which highlights for us not only the risks but the mitigating actions that civil society organizations were able to agree and build consensus on as important for responding to the different risks. So as we look at legal barriers to access services for key populations and no legal protection for victims of discrimination, we have as a mitigating action removal of legal or policy barriers to access to services for key populations and redress for victims of discrimination. So basically saying if we are not able to provide for an environment in which there are enabled efforts to remove legal or policy barriers to access to services for these populations and redress. It is very difficult that no matter how much funds are invested in reaching these populations, we will continue to not reach those that need the services most. Limited capacity of civil society organizations to sustain their programs. We need to see strengthened institutional and organizational structures of CSOs, inadequate data on key populations for evidence-based planning. We need to see strengthened surveillance systems to provide data for evidence-based planning for key populations. And also, this last risk, which is actually repeated, speaks about the barriers that are sometimes posed by some faith-based organizations to the efforts being undertaken, especially as it relates to key populations, and the mitigating action being increased engagement with civil society organizations and communities to increase sensitization and dialogue among all faith-based organizations. And we know that this is something that is happening at the regional level where organizations or networks such as the Pan-Caribbean Partnership are focused on building champions at the faith-based level to be able to further advocate and provide support to the work of HIV and the other diseases in the different countries in the Caribbean. Sustainable governance and partnerships. Again, the risks being TB and malaria not included as key components in National AIDS Strategic Plan. Important to, as a mitigating action, review the sustainability of HIV, TB, and malaria joint programs beyond the Global Fund. We know, for example, that the different diseases are under a joint program being supported by the Global Fund. But what happens to TB or what happens to malaria after the Global Fund transitions out of the countries? So the recommendation is an in-depth review of how this joint program will be sustained and if it is sustainable beyond external support. The country coordinating mechanism is a Global Fund mechanism that is dependent on Global Fund. Again, review exercise of CCM and NAP to discuss the possible integration of CCMs as a national entity beyond Global Fund. We know that the multi-sectoral approach has been effective. It has proven to be effective in many countries, but how is this sustained beyond the Global Fund projects? Lack of meaningful representation and participation of civil society at the NAP and country coordinating mechanism level. Increase meaningful participation of civil society and communities in national coordinating mechanisms of the response. And this is always important because we know that to some extent, civil society organizations, and in particular key population communities, are involved in the national response, but yet we keep hearing from civil society organizations that they do not feel that their representation is really significant and meaningful because they are not engaged in the real decision-making processes. And sometimes some of them even feel that they are just invited to participate to show that key communities are being engaged. Limited coordination and communication among civil society organizations for collective action. The mitigating action being strengthened national coordinating coalition to ensure meaningful involvement of all CSOs and communities. When I was in Guyana, I learned about the National Coordinating Coalition. I was very much impressed to see that such a national effort was being made to bring together civil society organizations. It would be interesting for me now, several months after, to learn how this has really worked out. Sustainable financing for civil society organizations, the risks being lack of financing to sustain their organizations and programs, especially for key populations, and limited capacity to mobilize resources at international and national level. The mitigating actions being introduction and implementation of government social contracting to sustain civil society organizations' contribution to HIV, TB, and malaria response. Limited capacity of CSOs to mobilize resources at international and national level. The significant participation of civil society organizations in resource mobilization and program budgeting, and lack of an investment case which highlights the value of the work of civil society organizations. Mitigation action being an investment case exercise to highlight the work of civil society organizations and justify national funding support. This is an area that I believe should be given priority in Guyana and in other countries in the region because the value of contribution of the work of civil society organizations many times has been has not been given the attention that it should because many times civil society organizations are the ones that have been doing a lot of work in the response with limited resources, with limited human resources and finances. And so as we look at the support that is needed from the different governments in Guyana in this case, it is important that there actually be some evidence, such as an investment case exercise, a report that can be used for further advocacy at this level. And so in concluding, I would like to share that it can be concluded that the regional LAC platform methodology was applied in Guyana effectively and that the expected outcome was achieved, something that many other countries can learn from. That civil society successfully engaged in a process that was participatory, informative, and proactive, resulting in a joint vision and plan of action. And in so doing, civil society in Guyana sets a precedent for the country coordinating mechanism and other civil society organizations in the Caribbean region. It was effective to coordinate through a civil society organization, such as the Guyana Trans United, for the mobilization of participants, especially those that are not members of the CCM or subrecipients. Again, we thank GTU for really going out of their way to assist us with mobilizing as many persons as possible to participate. Also important to have engaged the CCM from the onset and to have them participate in the dialogue to ensure continuity and ownership at the national level. And all the organizations were grateful for this opportunity provided to them to learn about the Global Fund's policy regarding transition and sustainability, as well as for the opportunity to discuss from the civil society perspective and develop a vision and mission and a plan of action in preparation for the transition process in Guyana. The different organizations agreed that there is a need for coordination and collaboration among themselves to decrease duplication and maximize on efforts to meet their common goals and those of civil society organizations' transition and sustainability plan that was developed as a part of this process. As the National Coordinating Coalition has already been established and is working towards achieving this, there is need for greater support and opportunities to make this an effective initiative. And it is recommended that as a follow-up to this project, the civil society organizations receive additional technical support in the development of a monitoring and evaluation plan, as well as a resource mobilization plan to complement their CSO transition plan. It is recommended that further dialogue take place between the CCM, the NCC, and the Guyana TransUnited to ensure that the civil society organization plan of action will be incorporated into the National Transition and Sustainability Plan. This will foster national ownership, commitment, and support. I can share with you our experience in Belize with the CSO plan of action that was developed in a similar social dialogue process, whereby this key report is now being used by the country coordinating mechanism as a guide for the development of its present transition global fund requests. So we are happy to report that it is being used in Belize, and the expectation would be that it would also serve to guide the process in Guyana. And international partners such as USAID, PEPFAR, UNAIDS, the Global Fund, and others can use this report as a guide and resource for future program and funding processes. And so, with that said, I want to thank you very much for your time. We are going to provide for some space for a bit of discussion, but I just want to share with you that we are happy that we were able to engage the stakeholders in Guyana in this process. And it is our expectation that other countries in the Caribbean that are going through the same process of transition assessments and planning will be able to learn from their experience. So, with that said, I say thank you very much.
Thank you so much, Marta. It's a pleasure for me present today you in this webinar. And remember, if anyone have any questions or comment that they want to share, remember, if you are in the platform, LAC Platform website, you need a click below of the video to send your questions and comments from YouTube. And Marta, we have a question by Nastasia Rambaran. In risks to sustainability, malaria and tuberculosis are not components in the National AIDS Plan. She can understand why tuberculosis should be included, given risks in HIV. But how does malaria fit in with an AIDS plan?
Okay, thank you very much for the question. I believe that the process within the different countries would be different as different countries are focused on different diseases. In the case of Guyana, the recommendation was for there to be a review of the feasibility of sustainability of these programs. For example, you are right, joint HIV and TB, and a focus on malaria to be able to see if beyond the Global Fund support for malaria, the response will be sustained. So not necessarily that malaria would be joined with HIV, TB, but that the process would provide an opportunity to look at how possible will the program for malaria be sustained beyond its present support from the Global Fund. Thanks for the question.
Thank you, Marta. We have another some questions. What's happening since the dialogue in Guyana? Is there an advance in the mitigation of risks? Can it be said that is the now possible to observe a difference?
Okay, well, I'm sure that the persons from Guyana would be the best persons to be able to respond to that question. But what I want to share is that the LAC Regional Platform provided this support to start a process that should be country owned and country led. And so it is our hope and our expectation that similar to what is happening in Belize right now, that they are going to be using this report as a guide for their transition assessment and planning processes.
Okay. Thank you again, Marta. I think for the final, what will be the final reflection for this type of activities that will to boost the impact of civil society in the Caribbean? Because Guyana now is an example for the other countries.
Exactly. The at least from the perspective of the LAC regional platform, the platform is in a position in the Caribbean to provide some level of technical support, technical assistance to the different countries that may be interested in requesting support from the Global Fund to be able to carry out exercises such as this. The reason why, from the platform perspective, we were only able to focus on Belize and Guyana in the first phase of the project was because these methodologies were being piloted. And as I said, it was also done in other countries like the DR, Peru, Paraguay, Panama, in the LAC region, again, as methodologies, tools that are now available to the different countries for them to be able to carry out their own processes. And if any of these countries, especially in the Caribbean, are interested in carrying out a more in depth exercise, then technical assistance through myself as the Caribbean liaison is available to prepare some proposal to the Community Rights and Gender Initiative of the Global Fund to get that much needed support. I hope that answers the question.
Yes, thank you. And the final is, what is that advice for the other civil society in the Caribbean or in Latin America or in another countries to carry out activities that may be valuable for their impact?
I think that the greatest lesson learned from this process is that the community, the civil society sector must play an integral role in what happens next as it relates to transition, preparedness, planning, and beyond transition. We know that this is not the first time that civil society would be involved. Civil society has always been there from the first cases of HIV, TB, malaria up to where we are today. But now the recognition of the value of the work of civil society organizations and looking at how other stakeholders can work jointly to support and to build the capacity of civil society so that it will be better able to continue the work of reaching especially those most difficult to reach populations. So the greatest lesson is invest in communities.
Investing communities is the final conclusion of the webinar today with Marta Carrillo. Marta, thank you so much. And if you want to share another thing or another comment, welcome.
I just want to say that this would not have been possible without the involvement of the Guyana Trans United organization as well as the Guyana CCM, in particular the support at the secretariat level, and all those persons that met with us and chatted and shared their experiences and challenges and hopes for a continued strengthened response in the different sectors and organizations. And so I want to say thank you. And thank you to you, Diego, and everyone at the platform for making this possible. We had been waiting to share this for a while, and I'm so happy that it finally happened today. So thank you very much.
Thank you, Marta, and thank you for your time for this webinar. And thank you for the other people for joining us today. We invite you to follow the LAC platform on the Facebook and Twitter, in addition to visiting our website. We hope to see you soon in another webinar, and thank you so much.